Welcome back. I'm Anastasia. My mission is to build a community of acceptance and authenticity, and I needed some adventure buddies for this journey of insight, and I'm glad it's you. You are all welcome here, and I'm grateful you decided to join me. And yes, my voice sounds really weird during these intros. I lost my voice before I got a chance to record them, so bear with me on that. And before we get started, I want to take a moment to thank my partner, Occupied Mind. Their goal, which you can read about more on their website, is to create a sanctuary of self-expression, a place where individuality is celebrated and true selves are embraced. Their belief is simple yet profound. Everyone deserves to feel at home in their own skin. I share that dream with them, which is why I support them, and my closet is slowly turning into an Occupied Mind showroom. Use code INSIGHTSWITH15 at checkout to find a shirt that speaks your mind and bears your soul. That's OCTOPIEDMIND.com, occupiedmind.com. Use code INSIGHTSWITHUS15 at checkout. Be authentically you. As a disclaimer, there may be swearing in this podcast, but sometimes we get caught up in the human experience. It happens. And sometimes we can talk about difficult or activating topics. So maybe put on some headphones if you need to, and remember that support exists for you if you want it. All right, everyone. Today, I have the pleasure of introducing Dr. Seher, a pelvic floor therapist based in Colorado. Dr. Seher is a pelvic floor physical therapist passionate about helping women reconnect with their bodies and reclaim their power. Dr. Seher owns and operates Embodied Healing PT, a small private clinic in the Denver area dedicated to holistic pelvic floor care. She works with clients in person as well as online, blending clinical expertise with a compassionate, whole person approach. In this episode, we talk about the pelvic floor, talk about how it's important to learn different techniques and practices related to our work, and how to follow a path, even if it doesn't make sense right away. And then we end by talking about steps that you can take to help your pelvic floor. This episode felt like a safe and comfortable space to share and feel validated, which is a great snapshot of how Dr. Seher helps her patients feel in her work. I am so excited for you to listen to this one, and hopefully we can build some insight today. Welcome, Seher, Dr. Seher, to Insights with Us.
Thank you so much.
Yeah, so you are a pelvic floor physical therapist, and I have so
Yes.
many questions for you today. So many questions, but let's get started with something just maybe a little bit more basic of what is a pelvic floor? What is pelvic floor physical therapy? Like, what even is this?
Yes, I love talking about this stuff, so I'm really grateful to be here. So what the pelvic floor is, it's a group of muscles that literally we all have, regardless of gender. Every human has a pelvic floor. And there are these muscles that go from your pubic bone all the way to your tailbone, and they're pretty much the floor of all of your organs. They support your pelvis, they support your reproductive organs and your abdominal viscera, and they do so much for us. They keep us from pooping and peeing our pants. They allow us to actually excrete too if we needed to, and they work a lot with sexual functioning and posture as well as breath too. So they're super important, but because their function is automatic, not a lot of people know about it or even know that they exist or pay attention to it.
Okay. So in physical therapy, what kind of work do you do? Because like if it's natural, if it's automatic, people don't even know it's a thing. Like, how do you then show up in that work?
Yeah, great question. So as a pelvic floor physical therapist, of course, the system can get interrupted or disrupted. So there are times when the automatic functioning is not happening. So as a PT, I bring awareness to this area and I allow for people to unlock how the pelvic floor is supposed to work with the rest of the body, because it's not a muscle group that ever works on its own. But sometimes the system can get interrupted, just like with any body part.
Mhm.
So a lot of what I treat is anything that relates to bowels, bladders, sexual functioning, and things like that. So for example, like urinary leakage. So if you ever experience leakage when you laugh, cough, or sneeze, which is honestly a lot of people out there, especially women. Or if you experience any type of sexual dysfunction, whether it's pain with intercourse or difficulty with erections, things like that, that all falls under the umbrella of pelvic floor work.
Well, and you said it's connected as well. So do you also deal with things like GI issues and maybe just like stomach pain? Maybe it could also ease some of that.
Yeah, absolutely. So the pelvic floor is connected to your core in general. So anytime your abdominals and your core is working, your pelvic floor is also supposed to coordinate and work with it. And it's also connected to your diaphragm. So literally every time you breathe, your pelvic floor is supposed to move with your diaphragm. And you could also argue that it's connected to literally everything else, like your feet, the way you land on the ground when you run, the way you walk. It's going to affect your hips. No doubt that it's connected to your hips and your low back too. I always like to make the joke that I'm biased. I think everything's pelvic floor related, but it's actually true. Like this is the root of everything and it supports your entire trunk, right? So it's definitely gonna come into play with pretty much everything that we do.
I am so excited for this conversation right now. I can feel your passion.
I love it.
So, okay, how did you get into this? Because again, I can feel that passion. So where did this profession come from? How did it show up in your life?
Yeah, it's actually I get this question a lot. Like literally my patients will ask me this the minute I get them on the table and the minute we're done with like the interviewing them portion, they're like, "So, how did you get into this?" And I always have to I love to share. I'll tell you the whole story because we're here on a podcast and we've got the time for it.
Got the time.
But the short version is I love working with women. Um, and I love making people feel good about their bodies because these are topics that I do think it takes a special personality to talk about, because they're taboo topics or topics that make people feel uncomfortable. And I'm in general just like an open person and nothing makes me, for the most part, not a lot of things make me feel uncomfortable. So that's the short version. The longer version of it is it's so interesting that it kind of came into I started to realize how deep it was like after I started doing pelvic floor PT, but I pretty much always felt drawn to it. When I was in PT school, I went to PT school. I didn't even know what a pelvic floor PT was. I didn't even know what a pelvic floor was when I started PT school. So if you think of the journey of becoming a physical therapist, of course, you go to undergrad for 4 years and then as you probably know, because you had to also go to grad school, there's like all these prerequisites you have to meet, and you have to get amazing grades, and you need to take this test, and you need to do all of this. So I always had the goal of becoming a physical therapist in mind. And that was such a strong part of who I was in college that it's so funny to me that like I didn't even know that I was going to be a pelvic floor physical therapist. I just wanted to be a regular, like general PT who helps people with their body aches and pains and empowered movement. But then once I got into PT school, I learned about pelvic floor PT. I was immediately interested in it. However, I was freaked out by it. I thought it was kind of weird because it kind of is, which we can talk about more as well later. But a lot of what we do in pelvic floor PT is we're working with such an intimate area and we're talking about intimate topics and we're actually directly working with the pelvic floor. So what that means is I'm doing vaginal exams, rectal exams, perineal exams, things like that. And that freaked me out. That I was like, nope, like I'm not interested. I was interested, but that component of it was too scary for me. So I still, during PT school, didn't think I'd be a pelvic floor PT. So that's like crazy that I went like my entire education thinking I wouldn't do that, right?
Hmm.
But I was interested in it, and we had unfortunately, in PT school, you don't really learn about it that much, which is really funny. We had like one class at the last year of PT school where it's like the specialty class where like people come in and talk about the specialties. So I think we had 3 lectures on the pelvic floor, and I found it extremely interesting. It's cool. Like I feel like so many people find it interesting. Like it's like an easy topic to be intrigued in because it's relates to things that we do every day. Like we poop and pee every day. Um, So I was already interested in it. And then once I came into the field of being a physical therapist, within 6 months of my career, I was finally like, oh my gosh, let me just get this certification. And I had made really good friends with one of my coworkers who actually made me overcome the whole vaginal exam portion. She was like, let's just do it. And honestly, if it wasn't for her, I probably would have still ended up in it because it's my calling. But this was early into my career that she was like, let's just do it. And we did it together as far as certification goes. And I got really comfortable with vaginal exams like immediately because it felt so empowering to me. It was
Okay.
like, it helped me unlock all of this shame. Like, I realized the reason why I felt uncomfortable with vaginal exams in the first place is because of my upbringing. I grew up in Turkey. So I didn't realize I had all of this like shame and discomfort around that area that literally like went away because I had women, other people, other pelvic floor PTs work on me and me work on them, that it just normalized it. And that also, with years to come, just unlocked constant, what's the word I'm looking for? It unlocked this realization that like, wow, I am meant to do this. And then as I got deeper into the field, I'm realizing that the reason why I feel drawn towards helping women and working with women is because a lot of the women, and this is where I get a little personal, a lot of the women in my family have been through a lot of abusive relationships and trauma. And luckily, thank God, like I haven't. And I feel like I'm meant to break that cycle and just help women heal. So if you have experienced sexual trauma or abuse, and you feel tight and constricted, I'm here to help you hopefully release that and work through that. And I think that's like more of a spiritual and purpose of life that I have come into somehow. So I love it.
Where do I sign up?
Yeah, you can sign up on my website, girl.
No, this is so powerful. And just hearing that story, I have so much appreciation for your self-work to get to that point where you can help empower others. Because it's not like you're like, oh my God, from day one, I'm totally okay with this. This is fine. Like you experienced the healing and progress and empowerment that you're now trying to help your patients experience.
Yeah, absolutely. And thank you for listening to that long story. It's just so fun to look back and think of like, I was drawn to this, but I didn't know why, and it made me uncomfortable. But now I can look back and it all makes sense. So you're so right that I think a lot of people, when they're passionate about their career, it's you might not have the awareness at the time, but it might unravel and you might realize like, oh dang, I needed that work as much as
Mhm.
I help other people do it, like I needed it myself.
Yeah. And like I always say, growth happens in the discomfort.
Hmm.
And not going so far that you're so far out of your comfort zone that it almost traumatizes you more, but
Yeah.
finding those steps and those levels, you're like, this is a little uncomfortable, but I can do it. And then that becomes comfortable, and you're like, well, this is a little bit uncomfortable, so that I'm just going to go and do that. And then you, like you said, you look back, you're like, wow, I have come so far.
Hmm.
And now I get to take this and help others.
Exactly. Yeah, it definitely was like a little exposure almost. Like I first learned about it in PT school, but I was interested. And then the guest speaker came and I was like, oh, this is cool. And then once I got into my career, I would constantly hear the other part of it is you constantly hear about the need for pelvic floor physical therapy in a regular, I don't mean to say the word regular, I just mean like orthopedic physical
Like
therapy clinic.
traditional
Yeah,
paths,
or just like
PT.
orthopedic PT is just exactly like any other body part, but the pelvic
Mhm.
floor truly is a specialty. I truly think you need extra training to treat it. And to make people feel good, I do truly believe you need a different environment than the gym environment, right?
Yeah.
So once I got into the field and I was working in like a traditional orthopedic setting, I was realizing like I need one-on-one time with people and I need to be in a private room. I can't just talk about these things out in because if you go to a traditional PT for like your knee, there's a bunch of PTs in one big gym and you're all like it's a social, it's a fun environment, don't get me wrong, but maybe if you need to talk about urinary leakage or maybe some trauma, you're gonna want to feel safe. So
Yeah.
it was the fact that I was also drawn to that private environment of like one-on-one care that
Mhm.
also set me up for wanting to do pelvic PT, which is why I think I finally was like, I'm just going to overcome this vaginal exam thing and just do it. Is after 6 months of being in the PT setting, I was like, okay, I need something that feels
Mm-hmm.
a little bit deeper for me.
So, can you tell me a little bit more about how you made your single room environment more comfortable? Like, how do you help your patients feel more comfortable? How do you ease them into, we're going to have a vaginal exam or a rectal exam, and like, this is what this work looks like?
Oh my gosh, I love that question too because I think it's an art. I truly think you have to be good at it. And in the beginning, I wasn't good at it. And
Okay.
the client in front of you can tell when you feel awkward, so then they feel awkward. And I want to say now I've done it so much that people immediately feel comfortable with me. Honestly, it's been a while since first of all, I will never convince anyone to do an internal exam with me. Like, I'm never here to convince anyone to let me touch them in any way or do any type of hands-on work if they're not ready for it. Um, Luckily, I do th feel most people who reach out to me, they are ready for that step. And then as long as I make them feel comfortable, they're usually enthusiastically consenting. But this comes from just my first job. I worked at a ortho clinic where honestly, I'm not gonna lie, and you might know this with your partners being in the field and interviewing lots of other PTs. In the insurance-based model, you are seeing so many clients. You're seeing like 20 patients a day, whereas now I see 20 a week. So like just think
Mhm.
about how crazy of a difference that is. But in the traditional PT model, that's when I specialized in pelvic floor PT just a little bit. I was like dabbling into it. So I was still an ortho PT, but I dabbled, you know? And they gave me this tiny little room and they were like, okay, we're gonna give you like one pelvic floor patient a month or like just to get me eased in. And that's what I was comfortable with at the time. But I realized being in that small constricted room where there's a gym outside and there's loud noises, like it just wasn't getting people feeling
Yeah.
safe. So now I'm telling this person who walked through this clinic, this gym area, and I'm at the time like people still sometimes think I'm like too young, but I'm 29 years old at this point, but at the time I was probably like 25. So it's like this woman in her menopausal years talking to some girl who's in like this gym setting and who's saying, "Let me put my finger in your vagina," you know? So I realized the setting was not making people feel safe.
Yeah. Well, and even just for the fact that we're in audio, as you were describing that, you literally got smaller too. You're like closed in, constricting, like the
Yes,
space does not feel safe even for you to be doing this
yes.
work. Why would your patients feel safe?
Absolutely. And I truly do think there's an energetic exchange where, like, if I'm awkward, I'm already early into my career. I'm already kind of awkwardly bringing these topics up. And now the setting, I'm like slightly ashamed of it because I'm like, you just had to walk through a gym and like walk through like five dudes getting like working out in order to come
Yeah,
sit in
that's
my
not
office.
right.
And then I'm asking you to undress. So, that's the thing I have about, I do think you can go to a pelvic floor PT in an orthopedic clinic and you can still have a good experience, but it's just not what resonates with me. So after that, I left that setting and started working for just a pelvic floor facility. But same thing, insurance model, just was seeing so many clients a day, but everyone was doing pelvic floor PT. So it was a lot more of a safe environment. The rooms were bigger. It was just like so comfortable and so normalized. And my mentor at the time just taught me how to um, get consent and also explain everything that's happening. And then I really bloomed at that job. Like that really taught me everything I needed to know. And then the job I had after that, I didn't last long. I went into a non-insurance based clinic and it was again an ortho clinic, but I was the pelvic floor PT and similar situation, but only did pelvic. And I was their specialist because honestly, everyone wants a pelvic floor specialist in their clinic. Like that's just,
Because
and
it's so
that's the
important.
it's important, and that's the beauty of this specialty is like you are special. Like you get to treat something other people can't. So I got hired at like another clinic and same thing. I just really wasn't vibing with the gym environment. my office where I, have to step out. I like to step out and give people a chance to undress and then step back in. Every time I would open the door, there was a waiting room there. It was just
Mm.
honestly not hitting right. It just wasn't feeling good. So I didn't last too long at that job, and I realized like I need to just create my own thing. I need to have my own, which I'm so grateful, right? Because now I have my own
Yeah.
practice. But my practice now, the setting is perfect. It's exactly what I need it to be. Clients always walk in and they're just so happy to be there, and they're like, "Oh, this is so nice," and they already feel grounded.
Yeah.
Um, and then as far as getting people comfortable with the work that I do, I'm just always explaining every single thing I'm doing and why I'm doing it. I've had clients come to me from going to other pelvic floor PTs, and they say like, that I'm teaching them so much more and that they feel so much more comfortable with me. They don't feel awkward at all. And it's simply because I actually take out my model and I show them the muscles and I explain to them why I'm doing what I'm doing. So it's not just some random person just going inside of your pelvic floor without you fully understanding. Because if you don't fully understand why I'm doing that, how can that feel safe?
Yeah.
So
Well,
I
and
over explain.
I love this because I'm a trauma therapist. I'm certified in
Mhm.
EMDR, and a big part of what helps people feel safe is that context.
Yeah,
And, my brain is listening to your story and kind of taking my perspective of trauma work and putting it on top of it because pelvic floor work, we hold so much trauma in our hips. And there's
oh
so
yeah,
much tension. Like, I'm pretty sure I have an overactive pelvic floor, which I would love to know more about your perspective
classic.
on, like
Yes,
overactive versus underactive. That's one of my questions.
yes.
But if someone, like, if I went to a pelvic floor therapist who didn't give that context and they're just like, I'm doing this or I'm doing that, or they just like go and do whatever, I'm going to tense up. I'm like, why are
Yep,
you doing that? What's going on? And then you're not going to have as effective treatment because I'm like literally tensed up with anything that therapist tries to do versus if you're giving the context and you're giving, space and you're letting your patient breathe of like, we don't even have to do an exam today. I don't have to put my hands on you
exactly.
today. Like, let's just go with what you're comfortable with and give you as much information as possible so that in the future you might be comfortable going there. That builds the context, that builds the safety. Your patient's literally going to relax more, and then the treatment's going to be more effective.
Absolutely. Yeah, exactly. And the other thing I like to tell people is once they have consented, I'm like, okay, wait, by the way, just so you know, you can withdraw consent at any time. And I check in with them as we are doing everything. And as I'm doing everything, I'm explaining what I'm doing. So, okay, I'm going to lift the sheet up now. Okay, I'm going to have you butterfly this leg. Okay, I'm going to start at your bone and then I'm going to work my way down. Like I'm narrating what I'm doing so that they know that there's intention, there's purpose. And don't get me wrong, there are some people who like don't care. They're like, yeah, I just had a baby. I've had a bajillion people in there. Like, just do what you got to do. So not all of my clients are trauma clients, but you still have to show up with the same mannerisms because you still just never know. No matter how
Mhm.
comfortable someone seems, you have to also go the extra step of making them feel comfortable. And you're absolutely right. If I'm rushing into things or not explaining it, that constriction in the body that we were just kind of like demonstrating, that happens in the pelvic floor. You clench your jaw, you clench your pelvic floor, and then that makes the exam harder. So
Yeah.
you're absolutely right.
I want to hear a little bit more about maybe I want to hear about everything. I was going to ask more about like your intake process and like building that trust a little bit more because if you, like you said, there are some patients who are like, yeah, nope, I'm used to people looking down there, go for it, do whatever you want. But it also could be like a faux window of tolerance. Like they're just numb to it. So, like, yeah,
Ooh.
do whatever you want. And maybe like down the line, you notice that somebody actually isn't necessarily comfortable with it. Like, do you ever feel like you have to backtrack a little? And
Ah,
yeah.
great question. I really think I keep saying great question to everything. Like I'm really on a podcast. You are meant to ask good questions.
I'm also a therapist. It's literally my job to have
Yeah.
curiosity and learn about you.
I'm like, these are like the best questions ever.
I'm just glad we're
Okay,
vibing. It's fine.
I love it. So yeah, that I want to say I'm pretty I'm pretty observant and I'm paying attention to my client and how they're showing up. So for the most part, I can kind of tell what they need. I'm not saying I'm perfect every time, but that hasn't happened too often where I have to backtrack. But it's interesting that you brought it up because it literally happened to me last week
Oh,
for the first time in a very long time
okay.
where somebody like consented. She was like, yeah, I'm down. We always do this. Do what you have to do. I just want to fix this issue. Do what you have to do. Do what you have to do. And the minute I went through my usual, like explaining everything, but the minute I actually did start doing the pelvic floor internal work, I realized like I was feeling really tense and anxious. And this is the thing is like I always pick up the energy of the person on the table, the person that's in the room. And she was so sweet and she was so funny. And I could just tell that she was not, was not super comfortable for her. She felt awkward. And a couple times I was checking in with her and she was like, yeah, it's super awkward. And I did afterwards think about, okay, you know what? Maybe we will backtrack a little bit. And I told her once it's not like the whole session is pelvic floor internal work, but instead of spending more time in there like I typically would, because typically you can spend time releasing the muscles, increasing the blood flow. I just more so did an exam and then allowed her to get dressed and then had her sit down and just talk to her about what was going on. And then I told her before she left, next session we can do some more external work. We don't have to do internal. Let's do, because there's other tools. We can do dry needling. We can work on your abdominal wall. We can work on your glutes. So I kind of reassured her that next session I had some other things planned for us. And we'll just have to see when she comes in how she's feeling. And I definitely want to ask her. I only saw her once, so I don't have much updates,
Yeah.
but it was one of those things where I did feel like I had to backtrack. Because she became like less talkative once the work had started. I'm sure you know all about
Yep.
that. And so, yeah, just having to pay a lot of attention. That doesn't happen that much, but I can
Yeah.
feel the energetic shift and then you can see it in the client. So we'll see how that goes, but absolutely you have to backtrack all the time in the physical therapy world, not even just in pelvic floor work, but sometimes you do an intervention and it literally doesn't work or it makes it worse and you have to backtrack. And if the client's not communicating with you, you have to kind of get it out of them sometimes. And I think that takes clinical experience. I
Yeah.
think the younger me would not have felt as comfortable or had the younger me might not have noticed as much.
hmm This resonates for me a lot. So in trauma work, there's a lot of pendulation
Mhm.
where, and so often, not always, but the majority of the time, my clients come in very intellectual with their trauma. I need to
Yes.
get it done. I want to feel better. Just make it happen. Like, what tools do I have to do? Give me my homework. It's like trauma work isn't about homework. Trauma work is about slowing down so you can feel that safety and just like actually release and feel what you need to feel. And
Yeah.
so often they're like, yes, I could do that. Yes, I'm fine. Yes. And then like I hit something that resonates and suddenly they drop into their body in a way that maybe they've never done before ever in their lives. And it scares the shit out of them. Right.
Oh,
And so then it's like what did you just do to me?
yeah,
And so then you have to
absolutely.
kind of go the other way and rebuild safety and go, that's normal. Like,
Yep.
that's okay. So yeah, that's resonating for you. Do you want to say more about your
Yes.
experience with that?
So here's the thing about pelvic floor PT too. I am not a freaking therapist. I'm a physical therapist, but I do not have a mental health background. Thank God that I went to therapy myself for a couple of years and I probably will go back at some point. And thank God I love like reading about like all the therapy books and it's so interesting to me and I love working with like the space of healing. So I have dived a little bit extra into it. Um, but I am not a mental health therapist, and I had to really learn how to hold space while staying in my scope with these things. So, this is one of those things where, like, automatic, if you're not already seeing a therapist, the beauty of my clients is that they're already seeing a therapist. I'm like it's usually the pelvic floor PT comes after because
Yeah.
people want to work on especially trauma clients. They're usually in therapy first, and then for them to be ready to do the physical release, I feel like they've already been in therapy for a while. So that has happened to me where enough times where once we do the release work, people are feeling so confident, so excited to be in my office. And then once they go home, they're like a little dissociated. They're a little bit like numb or they're emotional. I had one client say to me once that she slept for 15 hours, like just really needing time to rest. And I'm grateful that I have this background and I've collaborated with other therapists that I can recognize that as like a symptom of, okay, wait, something got activated within you. And now I actually normalize that before it happens. So now I do have like a little disclaimer when people come in, hey, just so you know, things might come up. And that's normal and it's okay. And we might even expect it. So after this appointment, what do you have planned? Like, do you have a full work a week planned? Are you able to rest? So I kind of set people up ahead of time so that they're not freaking out. And sometimes even during session, I think people don't, it's so interesting to me that people don't expect it to become emotional, and they'll be very embarrassed when they cry in my office because you don't think of going to a physical therapist and having emotions come up and then having maybe needing to cry, maybe needing to like process something, right? Because it's not what physical therapy traditionally is. And I have tissues in my office and I'm like, this happens all the time. People are emotional all the time. People cry all the time. And I think the old me, and maybe you could give me some pointers. That would be really nice if you could give me pointers on like how to hold space. But the old me would have been like so sad that someone's crying and would have been like, here's a tissue and try to hug them and hold them. But now I just allow them to and I ask them what they need. And most people don't want you to make a big deal when they're crying in your
Mhm.
office, but they just want to feel normal.
Yeah.
So that's stuff that I've had to learn over time. And this is the beauty of being a pelvic floor physical therapist is that there's so much invisible like work that you have to learn in order to
Mhm.
facilitate. And I'm sure you can agree, even though you go to school for it, like it's just
It's
takes a special person to hold space.
and there's so many layers to it as well.
Mhm.
And no matter what you go into, there's going to be different people that can hold space in different ways. And that's why there's so many different types of therapy and so many different types of specializations in PT because like this is what I'm able to hold space for. And so yeah, it takes a special type of person to be like, I'm going to sit in the trauma. I'm going to sit in the discomfort. And not only am I going to do it, but I'm going to invite you to join me in it, even though you didn't necessarily sign up for it. You signed up for feeling better. Like this is a part of that work.
Mhm.
And, I will say that as I am a crier, I have always been a crier. And when I was young, I used to have a lot of shame around that because, stay tough and don't let people see you cry and like, whoa, little baby,
Yeah.
like little baby girl, whatever. I have three older brothers, so I got picked on a lot. Crying
Oh,
was not
fair.
accepted. um, and but I'm a crier. I have cried in almost every single PT appointment I've ever been to. I broke my wrist
Oh,
in 2019, Colles fracture.
okay.
And I almost fainted during the first PT session because it was such an intense experience. And it wasn't even like, do the strengthening. It was literally just like rubbing it with a rag to get the dead skin off from the cast. And like,
Wow.
it was such an intense experience for me that I almost fainted and just like
Wow.
bawling my eyes out. So, like, yeah, it is so normal to feel release of emotions. And
You must
so,
be very connected to your body then, because yeah, it is, I would say it is normal, but you don't see that often with like the wrist and the knee. So
Mhm.
you must be very connected.
Yes, I used to not be. I've worked very hard to be embodied, and now it's like
Mhm.
I notice my body almost first sometimes, and then I'm like, wait, okay, I have like this pit in my stomach. What's going on?
I'm actually in the same journey right now. It's like my body is where everything is showing up as opposed to like my
Yeah.
mental.
Yeah, and then I slow down and I think and I like notice my thoughts. I'm like, "Oh, that's where I'm at
That's
right now. Okay, cool." And so being a crier, being somebody who's always been on the more emotional side, very in tune with my own, but very in tune with everybody else's energies, like that is a part of who I am. And I think that's what makes me good at telehealth therapy is that I'm always been like that. So I'll have clients who like barely shift their body language. And I'm like, what just happened there? Like, I feel a difference. And I think one of the biggest things of holding space is just that energy, being able to welcome it. Their nervous system is going to feel that. And one
I
of,
love that. Like if I can be grounded instead of freaking out because someone's having some
yeah,
kind of response.
they're going to know.
I
Even
love
if they can't
that.
verbalize it, they know that you're able to hold that
Mhm.
space. And if you need to verbalize it, one of my favorites is, seems like you need to cry. Let it out. Take your time. I'm with you. Like that's it. Just I'm with you. I'm along for
I
this journey.
That's so nice. That does feel, and the thing is, again, it's this, I have to stay within my scope and
Mhm.
I can't go too deep into the response that's happening. We do need to hold space for it and ground it down, but not allow it to escalate or just like I don't know. That's one of those things where, and people, I think the setting does matter. They recognize this is physical therapy, not
Mhm.
regular or mental health therapy. So I think people usually are like, okay, okay, I'm okay, and they take their time. But it is still really important to know
Yeah.
this and to. I've asked like other like trauma therapists, like, what do you do? What can I do? And I teach yoga, so I think it's also like this idea of like, okay, understanding how to be trauma informed and how to hold space. But these are the things that don't come naturally to everyone.
Mhm.
And it took me, a couple of years of working with people. And these are the things that as a physical therapist, you don't learn about this in school. And you're
Mm.
absolutely right. It's not just pelvic floor physical therapy. Yeah, when I was an ortho PT, it didn't happen as often in the pelvic floor world. It just happens all the time.
Yeah.
It didn't happen as often, but people would have wrist pain or elbow pain or knee pain and cry because it's affecting their life. So it's not always just like purely like, oh, this is just bringing things up in me. It's like, this is actually really deeply affecting me.
Yeah.
So, as physical therapists, it seems almost like neglectful to not understand trauma informed, like holding space and to
Yeah.
not understand like basics of like how a client would show up with trauma or basics of how the physical is actually connected to the emotional. So
Yeah.
that's where I love learning more. And that's why like I try to talk to therapists and read books and things like that. It's not within,
Yeah.
I have to stay within my scope, but if you're working with a human being who is trying to heal, you have to understand these things.
Well, and not even just like, oh, well, now I have to figure out how to talk to them about their mental health. Again, stay within your scope, but being
Mhm.
able to recognize that if they're showing up in physical therapy, even if it doesn't seem like a big injury, it could be an identity shift. It could have been a traumatic event that led to a minor injury. It could just be chronic stress over time, but that's going to show up in their bodies. And then when you do that work, it's going to show up in their mind and in their emotions. And so I just, everything you said, yes, 100%. I agree with it. This is why you are so good at what you do
Yeah.
because you're already holding space and not just, ooh, there was this emotional release. Maybe we should sit in this for a moment before we move forward. But just being able to recognize that trauma informed approach of every single one of your patients might have trauma in some way. And you don't know how it's going to show up or if it's going to show up. But if you just hold space for the fact that it could be there, that's everything.
I absolutely agree. And honestly, it's actually more common than people think, even in, again, like the traditional ortho PT clinic, because so many people come in with neck pain, jaw pain, low back pain. That is all, honestly. If a pain becomes chronic and it's not just an acute injury, it's not just post-surgery, if it's chronic, it typically has like an emotional or trauma component to it. Like it just does. So I love and it's so fun and it's so interesting to like constantly learn about all of this. But yes, like what you do is so complementary to what I do and vice versa. That it's so fun to have referrals like you and people and
Yes.
hearing you talk about it too also excites me because I'm like, yes,
I
she's
say,
the girl.
I knew
She's
there was a reason we connected, right? Like this
yeah,
needed to happen.
yeah, and even our mutual patient, our mutual client, she's so lovely and she always talks about some of the stuff that you do with her. And it seems to me like you get her in her body sometimes, where like you
That's the
guys are
hope.
doing, what were you gonna say?
I say, that's the hope.
Yeah. Yeah. And it sounds like it doesn't always have to be like analyzing and
Mm-mm.
intellectualizing. So I just love that. And
Yeah.
that's what made me feel connected to you as well. So
Yeah.
cool.
We both appreciate that mind body connection and try to see the whole picture. Like, if I could go to school forever, I would have a degree in something related to the body as well.
God,
So
absolutely.
just, I need
Did you
all of
ever
it.
do, like, did you ever have you looked into somatic? therapy, somatic
I
experiencing?
have. I haven't done it yet. So I was deciding between EMDR and somatic experiencing. And
Cool.
somatic experiencing was like this really intense, lengthy process. And, there was like a wait list and it was very competitive to try to get into it. And so I chose
Okay.
EMDR, and EMDR is very body based. It's like bottom up processing. And so
Yeah.
getting away from that intellectual. And what I love about it is, and not everybody, not every EMDR therapist would agree with me on this, but I feel like it's almost an umbrella where in it I get to do some somatic and I get to do some like ACT and I get to do a little bit of IFS parts work. And
Whoa.
so I have, I've worked with supervisors who are somatic trained and I've worked with some who are IFS trained. And so I get all of the language and I'm getting to learn a little bit about everything. I'm also, I got my yoga teacher 200
Amazing.
hours. So I've got that a little bit as well. My partner's in physical therapy, so I'm constantly
Yeah,
asking him
get
for
it.
like consultation of like, how can I bring this in? Like I have a client who's struggling with this in their body, but I think it's connected to their trauma and like, what can I do with this? And so like I'll get on the floor and I'll do movement with my clients.
Yeah, and that's what our shared client was telling me that you guys were doing some movement. And I was like, I love that. And I'm on the same boat as you with like in terms of if I could just study forever, I would, because it's so fascinating
Yeah.
to understand the human experience. And I was looking into doing like somatic experiencing, which is so funny because I'm pretty sure physical therapists can do it too, but it's so much like therapy that I'm like, okay, I need to wait for the right timing. And I'm sure in my, like, we're allowed to do multiple things with our career. We're allowed to explore different avenues. And I feel called to it. So I think eventually I will go there one day. But you're right, it's this intense, lengthy process. And now
Mhm.
I'm just reading like a simple book on it. And we're
Yeah.
just taking baby steps because I don't want to, I need to reel myself in. I'm a physical therapist. I need to just refer to my therapist friends and I need to just stay in my lane. uh,
I don't agree with that. I don't agree with
yeah,
that.
no,
I
okay.
think
Well,
that the
thanks.
more you learn and the more language you have, the more you can help people. And if you get
Yeah,
trained in somatic, in fact, I'll send you a link because I'm currently like I'm
please.
looking at a training that isn't through the like official somatic experiencing website. And so
Okay.
it's like a certificate versus like the full program.
Okay.
And so I'm
We
curious
should,
about it. It's the one that I'm interested in potentially
yeah,
looking
send
at.
it my way.
I
Let's look
will.
at it.
I will. Maybe we do it together. I don't know.
I know that would be really fun,
Be
actually.
fun. But yeah, so the more language you have and the more tools you have in your toolbox, not just this is my lane, but then you can go, well, you kind of need this. And then we can bring it back to the lane. And they're like, well, maybe you need a little bit of that. And then you pull them back. And so being able to ebb and flow with your patients and then tie it back in. That's what I always do. Because EMDR is like my main lane. But it's like, oh, you need a little bit values-based acceptance and commitment therapy work. All right, now let's bring it back to like the AIP model, you know?
Yes. Wait, I actually love that because pelvic floor physical therapy and what I do is so different than what I learned to do in school. It's and that's the beauty of physical therapy. It really is what do they call it? It's like an art, it's like a practice. Like everyone has their own philosophies. So I know that I'm allowed to do what I'm doing. However, you just made me feel so much more validated because I have my moments where I'm like feeling a little bit guilty because I do find myself like ebbing and flowing where I'm like stepping outside a little bit and I'm like, wait, this is not really physical therapy. This is kind of like trauma therapy. Like what am I doing? And then I have to reel it back in. But I want to say for the most part, I have found my own balance with it all. But what you just said made me feel super valid in that experience that this literally is an art. It really is a practice.
Yeah.
So everyone has to do their own thing where we pull from different things. And it's not that I think a thing that I sometimes think about that I should probably work on and that you actually brought awareness to is I like, for example, somatic therapy, right? There are certain exercises that are like, that's a somatic therapy exercise. That this is this rolling, this shaking, that's somatic therapy. I'm not somatically trained. I'm not trained in somatic experiencing, but I have given clients like somatic therapy exercises before. And that's where I'm like, okay, wait, I'm actually not deeply trained in this. So maybe I shouldn't be facilitating this work. I have like that like thought that
Yeah.
comes up. But what even the face you're making right now, I'm like,
No.
wait, you're right. I still have my education and my experience to know what's
Yeah.
good for the patient without needing to dive
Hmm.
into the whole thing, you
So yeah,
know?
your pelvic therapy niche is very niche, which I
Uh-huh.
could see how it almost feels like there's then bumpers up of like, no, this is my thing. But also in that, it is trauma work. It is trauma informed. It is
And
playing within this need for safety.
yes.
And, especially with somatic work, the way I always describe it to my clients is look at kids. Kids know how to regulate their nervous systems. They will run out into the field and just run in circles for 20 minutes. Like they will go into the corner and just like lay on the floor and just shake. Like they don't have societal pressures of this is what your body's supposed to look like and this is how you're supposed to show up. They literally will be like, I just want to like smack a pillow for a second. And they will. Like that's somatic work. It's
They
what
don't
is
know
your
why
body?
they're doing it. They're just doing it because it's
Yeah.
like natural. Yeah. I
And
love
so,
that.
like, kids don't need a certification in somatic experiencing to know how to regulate their nervous system. Neither do you. If you are in tuned with your body, if you know what your body needs, if you have the ability to look at your patient and be like, you need to shake right now, like you are holding something in, we are doing this really intense work, maybe you need to shake it out. That is you just being in tune with yourself and with your patient. You don't need a certification for that.
Yeah, that's such a great way to put it because that's literally what my practice has evolved to. So my business name, it's Embodied Healing.
Yeah.
And I opened up my practice about 8, 9 months ago, and I chose the name Embodied Healing because I honestly wanted to keep it open-ended for 10 years from now. I don't know what. I love pelvic floor health, but who knows? I might just be doing only somatic work, or I might have created my own session that includes all these little things. So embodied healing was my way of, okay, this is literally what I want to represent is being embodied and then the facilitating healing. So it's really nice to hear just like what you think and to be validated in that because physical therapy, what I'm doing right now is just like literally not what I learned in school. And it's not that I'm like
Same.
uh dropping all of that. It's just that you make your own. And
Yeah.
I think a lot of good practitioners do that, right?
Yeah. Oh, I agree completely. And I feel validated. Because I
I
chose
love that.
my business name, Happy Mind Wellness Company, because I wanted it to be
Uh-huh.
about wellness. I didn't want it to be just for the mind. And I specifically chose Happy Mind because a lot of people come in and go, I just want to be happy. It's like, okay, but what does happiness mean? Because like happiness is an emotion which is temporary. And so you need to find authenticity. You need to feel empowerment. You need to be able to rest. You need to be able to slow down. Like having a happy mind is being authentic, which means sometimes being sad or angry or hurt. And so I wanted to like reclaim the idea of happy, but
Oh,
then keep it open.
I love that. And even the word wellness, like I know like anybody can use that word and it can mean anything, but that's the beauty of vagueness sometimes, or like
Yeah.
wellness is not just one thing, it's like a million things.
Yeah.
So I like that word wellness as well. And
Yeah.
similar to like why I chose the word healing, like
Yeah.
healing can literally mean anything. It can mean like tissue recovery, like just physiological, it can mean mental, it can mean emotional, like it can be anything.
And
So
this
I
is why
love
you're
that.
so good at what you do because you aren't just saying, this is it. This is right. Everything else is wrong. I have to stay in my lane. It's that, but this could help too. Ooh, and maybe this is pulling me. I want to learn more about this. Like you are actively progressing. And I don't know if this is how you see it, but the way my brain is like putting all of these pieces together, it's like the more you kind of build your scope and build this language and have more experiences in education, you're almost becoming more of an expert
Oh
in the
yeah,
pelvic floor because you're like, but now I can see how this whole category plays into pelvic floor health. Like,
absolutely.
I've known you for 50 minutes and I trust you so much in this work.
Oh, that's so sweet. And you know, it's so funny to look back. Life is so I just love life. Life is so cool. It's the way that you set yourself up for things, and then in the end, it makes sense is something that I've been experiencing a lot in my career. Like the story I shared with you about, I felt drawn towards this, but it made me feel really weird and uncomfortable. Okay, I started my career and realized I actually feel drawn enough that I'm gonna overcome that discomfort. And then I finally got into the work and realized, oh, this work is healing me. And then I did my own healing. I'm still doing my own healing. And I'm realizing, like, oh, I'm actually trying to heal like, like my ancestral line. And then it's like this, the reason why I'm feeling called towards something is because there's something bigger, like I'm meant to do it. And this is me, like, obviously, like making everything into a spiritual thing because that's just how I roll. But even what you're saying right now, it's like if I'm feeling called to dabble in this and dabble in this and combine it, it's most likely because that combination is probably going to make a huge impact one day, you know?
Mhm.
Like if, and the same with you, like, so if you are feeling drawn towards somatic experiencing, then most likely that's like a calling that you need to tend to, because I bet once you dive into it, you are going to make such a big impact. So it, again, another component of like us validating each other, it's that if you feel like there's like a little itch towards something, anytime I followed that itch, even without fully understanding it, I have like blossomed, I've bloomed. And
Mm.
that's kind of the itch I'm starting to feel with just like somatic work, you know? So this
Yeah.
makes me want to look at the course that you're looking at.
Yes, I agree with that. And, bringing it back to what I had said before we hit record, where I felt drawn to meeting you and having this
Oh,
conversation and having this connection point in the community. And I am so glad that we reached out to each other because I feel this connection. I feel that validation. And I'm so excited with maybe what we can do together because this conversation happened.
yeah, I agree. And it's really nice to talk to you and get to know you as well, because now I feel so comfortable sending a client to you because I've actually sat down and talked to you and I understand your philosophy. So I'm actually also super excited.
Yeah, it makes a difference.
Mhm.
Okay, so I want to bring it back to pelvic floor a little bit. Um, I am curious what if there's anything that maybe isn't commonly known that you wish people knew about the pelvic floor or about pelvic floor health or anything that you do. You're like, man, if only people knew this.
Yeah, that one is huge too, because in general, I don't feel like people even know what the pelvic floor is and all of the roles that it plays. The main one that I think most pelvic floor PTs can agree on is when you think of pelvic floor physical therapy or pelvic floor work, everyone automatically goes towards Kegels. And I do wish more people knew that the pelvic floor muscles don't work to get on their own. So doing a bunch of Kegels on their own is likely not going to help anything. And there are some situations where it might actually make things worse. So in the cases of trauma or just hypertonicity or tension, doing more Kegels is most likely gonna create more tension. And I think sometimes people think because a pelvic floor, if a pelvic floor is tight or a vagina is tight, it means that it's also strong. But muscles can be actually more often than not, a tight muscle is a weak muscle because a tight muscle cannot relax enough to go through its full range of motion and to generate force. So I
Mm.
guess the main thing that I wish people knew more about the pelvic floor is that having a tight vagina should not be the goal, and having a loose vagina is actually a myth most of the time. It's not very common as much as society makes it out to be. Okay, I hate the word loose and I hate using that word, but I think that since we were like in high school, since we first learned
Yep.
about sex from each other, from our silly peers,
You're
we
supposed to have
learned
a tight
that.
vagina. Nice. Yeah.
Exactly. Or like,
Hmm.
oh, she's loose. She's been with this many guys, so she's loose. That's literally not how it works. And having a loose vagina is like not as common as people think. There are cases where the vaginal walls need a little bit more support. And honestly, just doing Kegels probably won't fix that at all. We need to work on the whole body. So I guess what I wish society knew was that you're more likely to be too tense and that creates weakness as opposed to too relaxed or too loose. And something like having urinary leakage, so like coughing and sneezing and having leakage come out, doesn't mean you're loose, doesn't mean that you're weak. It could mean those things, but it could also mean that you are too tense where the muscles have lost their function. It can also
Mm.
mean not coordinated. So to put it all into short, Kegels don't fix everything, and you probably are not quote unquote loose.
I love this. And I don't know if, other than, everybody go see Dr. Seher. I will put her information in the description and advertise her all over the place. But like, go see her. But also,
Seriously.
is there anything that maybe you do recommend our listeners maybe try doing here and there, like some sort of small or simple exercise that could benefit their pelvic floor without necessarily needing immediately to go to a pelvic floor therapist? Though I do recommend that.
Yes, absolutely. And honestly, I'm not one of those people that like is like, go to pelvic floor physical therapy, go to pelvic. Sometimes, no, you don't really need to. Everything's working fine. You just need to bring awareness to the area. And honestly, sometimes it's not accessible. So, of course, I'm all for people having their own little like practices to manage or to help their pelvic floor long term. The number one thing is just understand what those muscles are and learn how to breathe with it. So, every time we inhale, our pelvic floor is actually supposed to relax. And every time we exhale, it just goes back to its like natural tone. So if you could just stop and take a moment each day to just simply allow your rib cage to expand as you inhale and create space in your body for breath, then your pelvic floor will naturally also start to relax over time. So step one is just anything else you would do for your nervous system is going to help your pelvic floor. So, step one is breathing, understanding when to slow down and when to check in with your body and take deeper inhales to facilitate like that relaxation response. So many of us breathe very shallow or we breathe very vertically, where we only breathe through our chest. And when we do that, it actually doesn't allow our pelvic floor to fully relax. So, I would recommend for most people or for everyone actually to just practice breathing where the rib cage is allowed to expand. Just know that the lungs are in the rib cage, which goes all the way towards your abdomen up to your collarbone. So trying to get that whole area to expand is going to help the pelvic floor expand. And then the other thing would be to honestly check in every day. Like, are you clenching your jaw? Are you clenching your butt cheeks without like any reason? Like, are you just in that response all the time, which honestly, a lot of people are.
I was gonna say
And
I feel called out a little bit.
yeah, oh no, we all are. Like, when I first started doing this work, I would realize that sometimes I'm laying in bed and my butt is clenched. Like, why? Why am I laying in bed and my butt is literally clenched? Like, why am I
Yep.
in this stress response? So simply noticing that and then telling your body to unclench, remind your body that you are safe when you are safe, which is hopefully all the time or most of the time, right? Those
Mhm.
are going to go a really, really long way. And then if something does happen, like you are having pain with sex or like having more consistent urinary leakage, pelvic pain or heaviness, those are situations where it would be helpful to go to a pelvic floor physical therapist. But there's a lot you can do just by being aware, breathing, and maybe honestly going to a yoga class.
Yeah, I love that. Because again, as we've been talking about, it's the whole body. It isn't just a single muscle that needs to be worked. It's a whole grouping of muscles in an entire body, and it is all connected.
Exactly.
Um, when I was younger, I noticed that my core was always activated and like tight, and it could
Mhm.
never release. And I remember there was this one turn on my drive home from university that always felt way too intense. And it would always like, even if I took it slow, like it just felt so intense all the time. And then after like a year, I realized that my core was clenched so tight that whenever I did the turn, it's like my core was freaking me out.
Oh my gosh. Yeah.
And I would intentionally release my core
Mhm.
around the turn and it didn't feel as scary. And like that was a big insight moment for me and my pelvic floor. And
Wow.
just that work of like, I am literally tensed up all the time and
Mhm.
couldn't release my muscles.
Mhm.
And I've worked very hard to do kind of what you're talking about of actually let your muscles relax occasionally. Like, don't always be activated. Don't always be trying to have everything tight all the time because it builds safety to be relaxed.
Absolutely. And that's the thing about, I think that's like a regular, like just nervous system response. Like when we are stressed, we just constrict and hold things in. I also think there's a little bit of like the societal element of like, we are taught to suck in our tummies when we take pictures. We are taught to suck in our tummies so we can look better or look thinner and things like that. And there's a component of like high-waisted leggings that are constantly giving us feedback to suck in. So now a big thing I try to do is honestly, I can't even like handle leggings anymore. It's kind of funny. I'm just always wearing comfy, loose clothing. And then it's so interesting to think about how uncomfortable, myself included, people feel when you ask them to fully release their belly. Like if you can,
Mhm.
and the thing is, if it makes you feel uncomfortable to look in a mirror, maybe that's not the best place to start. But a lot of people don't like when I look in a mirror, I like automatically suck in without even realizing. Like
Yep.
it's just an automatic thing. So now I like will practice like looking down at my belly and letting it be soft and it doesn't and not worrying about how it looks and just letting it like be chill. And I like to tell people get on your hands and knees and like relax your belly as if it's dropping down and like let it hang, like let it do its thing. And that's just natural and normal. But we don't like the appearance of that, right? So we don't want to see it. So we don't want to do it. So I think that's like another thing to work on too. I'm not saying that that's what was happening with you. I think it's normal.
No,
It's
I
a
think
normal.
it was.
Yeah.
Everything you said
Okay.
resonates, definitely.
Amazing. Great. So it's like it's this normal nervous system response to clench your jaw, to tighten your neck muscles, and to tighten your abs and your pelvic floor. So
Yeah.
we have to constantly work towards that. And like right now, as I'm talking, I just checked in with myself and made sure my belly was just hanging.
I say I'm doing the same thing.
I
As
love
you're
that.
talking, as you were explaining the breathing, I was trying to like release and
Yes.
it's
And
so
I'm sure
important.
whoever's listening is doing the same thing too.
Say, listeners, you're not alone. We're all doing it.
I love it.
Yes. Okay, that feels very powerful to me. And again, very, what's the word? Realistic and manageable for anyone day to day. Being able to take those full deep breaths and release, being able to just get on hands and knees if you are physically able to do so, and like feeling kind of the drop with gravity, but also just existing and letting your stomach relax. That
Yes.
it's something that like I do intentionally try to do nowadays now that I've learned. But when I
Mhm.
was younger, it's like I don't know if I ever experienced that because I was so in it was so ingrained in me to keep
Mhm.
that stomach tight.
Hmm. I think it's a lot of people can relate. Like, no one ever taught us that it's actually better to just relax and let go a lot of times. So it's not some, I think it's something we have to unlearn because I do think it's this primal stress response that we all have. And then it just becomes automatically like our body just becomes accustomed to it. So I do think like you and I, most people and people that are listening probably have to unlearn that a little bit. And that is so powerful. Like you said, you don't need to go to a pelvic floor physical therapist. Like you don't need to go invest time and money into a PT if you just start with this. So in no way do I want anyone to read this and think like, oh shit, like I'm broken. I need to go fix this. Nope. This is like a common thing and you can just start working on it right now.
Yeah. And if you want support in it, Dr. Seher
Yeah,
is here to help you,
exactly.
you
Yes.
know?
Not to say don't see me either. I'm always here and I love it. But I think sometimes people think like I'm sharing this information because it's truly helpful and valuable. And
Yeah.
it's not like I'm just giving a little so that because you need more. Like sometimes it is that simple. Sometimes it literally is like, yeah, just breathe and let your belly go. And some of your symptoms, like maybe if you have pain with sex, maybe that will subside if you just breathe for three
Yeah.
months straight and just focus on relaxing, you know?
Well, and bringing mind body awareness back into it, if you do have a block around that, and it
Mhm.
is, societal or trauma focused, like a therapist might help with that, like a mental health therapist
Absolutely.
could help with the block so that you can then help your body. And
Yes.
just being able, or just recognizing that that block is there and noticing it and then practicing the release anyway. But it is all connected, and it could be trauma, and it could just be societal pressure, and it could just be that maybe you look in the mirror a little bit too often when we're not usually, like, our bodies aren't used to being able to look at ourselves.
Yeah.
We just exist in the world, and then suddenly there are mirrors literally everywhere, and you're constantly looking at yourself in a way that, like, past generations maybe didn't.
Mm-hmm. Mm-hmm. I agree. And honestly, don't get me wrong. The ability to go to a physical therapist, a mental health therapist, the ability to have all of these resources is amazing. And I think
Mhm.
that it's so empowering. So if you could have a collaborative team around you that's like rooting for your wellness, that's always going to be amazing. So I'm always all for that too. And I think there's like phases in life where you're ready to have a team. And then there's phases in life where you can just integrate what you've learned and work on things
Yeah,
yourself too. And you're
definitely.
there for them. I'm there for them. I have benefited so much from having a team myself that, of course, like whenever anyone is ready for it, I'm there.
Yeah. Well, and I always say, like, my job is to work myself out of a job. And some people come in for 10 sessions and they just want one specific thing, and I help them with it and they move on. And some of my clients, every time we kind of reach a goal, it's opened 10 more doors, and they're like, okay, but I want support going that way now. And, like, yeah, some people do trauma work on their own, and some people definitely benefit from having that extra support and that person that can be in the room or in the space with you and hold space for that trauma and that release, and be able to say, no, it's not scary. You are okay. Like, you might be scared, but you are safe right now. And that's okay.
Absolutely. And the other thing that I just thought of with hearing you talk was it's sometimes easy for me as a person who now feels very comfortable with the pelvic floor. It's very easy for me to say, yeah, just start on your own and you can just breathe. And I want to be so empowering and tell people that they don't need me and that they can do this on their own. But it's easier for me to say it because I'm comfortable with the pelvic floor. And sometimes I forget, like, how much knowledge I have. Like, you know what I mean? So it's so normal to literally think about everything I just said right now. Like, relax your jaw, relax your pelvic floor, let your belly hang. And you might try to do those things and it might not click. Like, you might be like, I don't know what she's talking about. I don't know if I'm doing this right. If anything, I have found that out a lot in my practice as a PT is that I teach someone something even in clinic and they feel so good in clinic with my cues. And then they go home and they're like, wait, what? And they're
Yep.
so confused, and then we just work on it for sessions. So I will say the other disclaimer is, as much as I want to empower people to work on things on their own too, I recognize that this is an unfamiliar area, and you're right, it's okay to be scared and it's okay to need support. And I have the same goal as you. I'm trying to get people to understand their body, to feel empowered and have their own tools. And there are some clients that come in for 10 visits and they're great and they're off in the real world and they're just doing their thing and they're teaching other people about the pelvic floor. And then there are some clients who need a check-in every couple of months and there are some people who need to come back because they need a reset. So I'm here for all of that.
Yes, I feel that. And I'm so grateful for this conversation because I feel like our treatment plans are so aligned,
I love it. Yeah,
our
me too.
perspectives.
I feel like I'm like, dang, I should sit down with all the therapists I ever refer to because now I like want to send you more people because I'm like, ah, she gets it and I get her.
Yeah, I literally have like a short list in my mind of, like, maybe I should talk to some people about this
I
and
love that.
refer them to you,
Oh,
because
thank you
I
for
think that
trusting.
they would benefit from having you in their lives.
Yeah, and I think so too. I mean, maybe I'm biased, right? That's a joke I like to make. I think everyone can benefit from going to a pelvic floor physical therapist, even just once, because you don't know how much you don't know and how much you can learn from just one session too. So
Mhm.
if if anybody's feeling inspired, I think it can be totally worth it.
Yeah. Yeah, and if you're feeling inspired, again, I will put Dr. Seher's information in the description. I will post it on my Instagram. I am going to do an intro at the start of this. So, like, your information is going to be everywhere. Feel free to reach out to me if you have questions.
Thank you so much. And I appreciate you trusting me.
Yes, instantly.
I love
Again,
that.
you just have that energy. You connected and we didn't even hit record yet. I'm like, yep, nope, love this. Okay, I'm
Hey,
here.
I can say the same about you.
Perfect. Is there anything else you want to add to this recorded conversation? Any big takeaways or like if our listeners end this recording and only have one piece of knowledge in their mind, what is it?
Yeah, I guess the one piece of knowledge is just give your pelvic floor some love and attention. That's all. Just check in every once in a while and just honestly notice if you are clenching your butt because I can guarantee most people listening are. So just if you can walk away with just simply generally being more aware of that area and telling your brain like, hey, this is the pelvic floor and hey, you don't need to clench down here and just reaffirming that and checking in often. Honestly, I know it sounds so simple and it might even sound like this is not even like groundbreaking information, but that alone will probably change your life.
No, I love it. I'm gonna put a little
Amazing.
sticky note on my computer, just like notice if you're clenching your butt.
Yes.
That's it.
Clenching is the advice.
Stop clenching, everybody. Your
Yeah.
jaws and your butt. Just no
Yes.
clenching. Let it
Mhm.
relax.
Exactly. I love it.
Hopefully, something we talked about today resonated with you. I know it did for me. And if it did, let yourself sit with that idea for a little while longer. If you have any questions for this podcast or any themes you'd like us to focus on in the future, send us a message on Instagram at Insights With Us Podcast, or send us an email at insightswithus@gmail.com. If you enjoyed this podcast and want to hear more, please follow, like, or subscribe. If you want to support the continuation of this podcast, you can donate. To do so, find me, Anastasia Soroka, on buymeacoffee.com. You can also find Insights With Us on Substack for exclusive content, including videos and other writings about my insight journey. You can find digital downloads on my website, happymindwellness.com. Thank you for being my adventure buddy. I appreciate you, and I appreciate you being here. Thank you for creating insight with us. I want to thank my other partners, the pelvic people, because everybody's bodies are different, and how we connect bodies, I'm talking pleasure here, should not be painful. Whether you want to have fun with yourself or with another person, whether you want to release the pelvic floor, just like we talked about in this episode, the pelvic people are a group of healthcare providers creating products to help your body heal and find your own path to pleasure. I'm talking internal and external work here, okay? For me, I really appreciate the external massager because my glutes and psoas do not know how to release. And I'm working on it, just like Dr. Seher and I talked about. So if you didn't know, everything is connected. I promise you, you know it now if you've gotten to this point in the podcast. So if you are tight in one place, then you're probably going to be tight somewhere else. You're not alone. And if you struggle to let go and find pleasure in your sex life, check out the pelvic people. Use code INSIGHTSWITHUS7 for $7 off at checkout. That's THEPELVICPEOPLE.com, thepelvicpeople.com. Use code INSIGHTSWITHUS7 for $7 off at checkout.